Hi guys, welcome back to my YouTube channel. I'm Prianka Evangeline and I'm your internet speech language pathologist. Today I'm going to tell you about the fourth question I'm asked often as a speech therapist. So let's go to the question. The question is, what do you do in speech therapy? What happens in speech therapy? Why is this important? What should a speech therapist actually be doing? If you're wondering these questions, then I'm here to answer it to you today. Okay, so what do you do in speech therapy? I'm going to answer this from my perspective as a speech therapist and what I do. So, the most important thing for a speech therapy to happen successfully is to have very good clinical reasoning. What does clinical reasoning I mean is the clinician or the speech therapist should know what they're doing, why they're doing, and how they plan to do what they're doing. Right? So, I'm going to tell you all this in detail today. So what do they do? What do I do? So first, whenever we see a child, whenever we see that a child has some difficulty, we should first assess, do a comprehensive, thorough evaluation of the situation. So we have to assess the child, the family, the child's skills most importantly. So what are the skills that we assess in speech therapy is receptive and expressive language skill. What this means is receptive language is how much the child understands language in terms of all the language components or the speech sounds or the words or the different sentences that the child understands. And expressive language is how much the child is speaking out of the things that they understand. Generally, receptive language is better than expressive language in most children. Play skills. Now, we also have to assess play skills because in young children, play is the way they learn. They don't learn through direct instructions like how it happens in school. And even if they do learn like that, they don't enjoy the learning. So, play is the most important, useful, evidence-based tool that we use for speech therapy. So, we also assess what is a child's play skills and how much they're able to play. So, there are different types of play. Again, I will link the video in this description and in the link above. You can check it out if you want to know more about the different types of play and how to play with your child. The third thing we do is the oromotor skills. Now, this is not done for all children. This is done only when there is a significant difference in how the child speaks or how the child eats, or if there's some drooling, the mouth is all jaws always open. So when we see signs like that, then we do an oromotor evaluation. Okay, now what does this evaluation tell us? This evaluation is needed because I should first understand the child's strengths, and what are the areas our child needs improvement in before I start to help the child. So this is going to give me a baseline information. The second thing is once I identify, okay, this child has so and so difficulties. Now, as a clinician, I have to think, why is this child having a difficulty? So we see the symptom. We see that the child is not speaking, child not talking to other people, not socializing. We know these things, but do we know why our child is doing this or why they're exhibiting this difference? So you have to probe in a little bit deeper as a speech therapist to see what is really happening inside the child's mind. So this is not very easy to do. So it is often overlooked, but this gives you some understanding of what is actually happening so that you can treat it better. Right. So in this context of why, what we look for is what is the cause or what is the associated difficulties the child has. Do they have an intellectual disability? Is there seizures? Do they have a genetic difference? Do they have some kind of infections or anatomical differences in the body or in the brain? So that is one avenue that we will check. The second one is in many of the disorders that we treat, we don't know the underlying or the cause. So, but we still know that there is a functional difference. Even though there is no anatomical difference, there is often a functional difference in how the brain works. So that underlying difference also, there's a lot of research and a lot of new information available in the academics that is telling us what can be the reason for this. So if you want more information about the underlying deficit, please check out my video where I have two videos. The first one talks about the organic reasons of a speech delay, and the second video talks about the functional reasons of a speech delay. So you can check out these two videos I will link it in the video as well as in the description box. So if you look at underlying deficit, lack of stimulation, this is a predominant reason I see many children have a speech delay, because as parents we are sometimes a little unaware of how to help our child and how to nurture our child's development. So this lack of stimulation can cause a language delay. Apart from this, when a child has autism or ADHD or a learning disability, otherwise called dyslexia, or a phonological disorder, we have to check why is this happening and what is happening inside the brain. Why are they not able to understand or process information in the traditional way? So this can be because of theory of mind difference or a social cognition deficit or executive functioning deficit. If you, these are all quite big extensive topics. If you want more information about this, let me know in the comments and I will make a video on this. Okay, so now we know why. We try to understand why, and then we have to immediately start with our action plan of how we are going to work. So this is a very common misconception. So if I know a few SLPs are also watching my videos, so if you watch the videos, please take note. When we start assessing the child and we are making a plan to help our child, the most important thing that we have to keep in mind is more than the milestones that is there in the test. Child should do this, child should do this, child should do this next. Instead of the milestones, we have to think about functional goals. How is that milestone useful to the child? Yes, children are supposed to be able to move their tongue and identify colors at 3 to 4 years of age. But how is this useful to the child? What is the child going to do with this skill, with this knowledge? So instead of writing a goal saying the child will do functional exercises, as a speech therapist, I will think, why is it really relevant, important for the child, useful at this moment? No, but communicating is important for the child. So instead of that, I will use ways to help the child ask for things and request for his needs. The second thing is, instead of saying the child will identify colors, as taking identifying colors as my goal, I will think the child needs to be able to use the information of colors in sentences, in talking about different things. So that is a communicative functional goal. Now, and the second way I'm going to, so I have done the assessment. I have a little bit idea about what is the underlying difficulties the child has, and I'm starting to make some goals for the child. Now, once I've made the goals, I will start using evidence-based goal-directed play. What I mean by this, evidence-based means that the techniques, the method I use have to have good sound research evidence. So I will make sure I have that. There are a lot of resources for speech pathologists and even parents to check out if the method is evidence-based or it is just some popular fad or some quick fix or something like that. But is it really evidence-based? Is it really good technique to use? Is it working? So we use evidence-based therapy, as well as we should do play. Play is the way children learn. You already know this. So in the play, we do structured play. We incorporate the goals into the play and we incorporate our techniques into the play activity. So in this way, we can help our child learn the skills that they are lacking so that they can go on to live good functional lives in their schools, in their families, in their society. So also I want to take some more time, a few seconds, to ask you to like this video, because if you like this video, it tells YouTube that there are parents, some more parents who will benefit from this information, and they can also be recommended this video. So if you like this video, it's going to help other parents also see and learn. Let me see you in the 5th FAQ in the next video. Bye.